To achieve the end of the smoking or tobacco epidemic in the United States, we have to, number one, devalue to the extent possible the very lethal product known as the cigarette that's responsible for the death of 1 out of every 2 long-term users. And that can be done in a couple of major ways that the FDA has been pursuing. One is to order the reduction of nicotine in all combustible or burned tobacco products to non-addictive levels, something that I've been advocating since the early 1990s, and which the science has proven can be very effective in dramatically reducing the number of people who smoke in the US over time. And the other thing that the FDA has been pursuing is eliminating mentholated cigarettes in the United States, because menthol is known to make it easier to start smoking and quickly become addicted. And it also makes it harder for the adults who use menthol cigarettes to stop. And in addition, there is a social justice component having to do with the fact that a very, very large percentage of African Americans who smoke in the US, more than 80%, are using menthol cigarettes. And this is why many folks are advocating the end of mentholated cigarettes to save more lives. Now, the important thing is that if and when the FDA moves forward and finalizes that process of ending mentholated cigarettes in the US, you also have to provide for that off-ramp. You have to provide for the opportunity for adults to quit entirely by promoting the most robust cessation options made clearly available, easily accessible through our medical and healthcare systems, and with good education and counseling. And the other thing is that we've got to make available alternative products, potentially some of them with menthol, that contain nicotine for those adults who are just not going to otherwise stop using nicotine or stop smoking, and that are far, far less hazardous or safer than the dangerous combustible tobacco cigarettes. And in fact, the FDA has authorized a couple of those products for sale in the marketplace with the understanding that they're going to be beneficial to the public health.